What happens when tummy aches won't stop? A very common problem in my practice. Right from the time a child is born, a little baby with colicky symptoms, pulling their legs up, parents feeding whether they are breastfed or bottle fed, desperate parents not knowing what to do, these cramps, what do I do about cramps? This is such a common problem. And when children get older as well, are they pooing enough? Are they they're constantly crying, unhappy? And recently, I'd like to tell you about a child I saw who's a bit older. And they had had a tummy ache for many months, seen by several doctors, been treated for constipation, allergy, gastroesophageal reflux, acid problems. Even the doctors had thought this child was in fact anxious, had tried to give this child IV Valium, had been treating the child for anxiety. The child had been to psychologists, and you can imagine the overwhelming problem when something won't get better. So what I'd like to do is tell you about a problem that I think that we've got to take seriously. Tummy aches in children are sometimes an underlying symptom. They're not necessarily a diagnosis in themselves. So what can the problems be with tummy aches? There are many different types of tummy aches, right from colicky problems, from the problems that children have when their mothers are breastfeeding. They might even be related to the diets of the mother. And formula milks, constipation, allergies to casein when starting solids, difficulty with different types of allergies to foods, which I'm going to talk about. And then, of course, difficulty when children get to school. You know, that potty training time when they're getting into school. Anxious, not wanting to go to the toilet at school. Fecal loading, withholding, not wanting to go to the toilets at school. You know, it's not necessarily the most pleasant places for children to go to the toilet. Having difficulty with that transition. And of course, you know, on the background of this is the kind of personality of the child who has difficulty dealing with these problems. And of course, the anxiety spreads through to parents, schools, teachers. And then, of course, when a child gets a bit older, you know, when all these kind of things settle down, like bad weather from the early childhood, what happens when a child is in the middle of, senior primary or even getting to high school? What can the problems there be? Then, of course, there are lots of other medical conditions. And it's so important, parents, not to ignore tummy aches. You know, children, of course, moan for a few days. Maybe it's related to going to school avoidance. You know, maybe there are some things. But what happens when it goes on for several months? This is not correct. And in this child in particular, I could tell immediately that this was not something that is normal. This child had lots of rashes. The child was what we call atopic, had eczema, had allergies, asthma, hay fever, sinusitis problems, big family history of these problems. And of course, this child occasionally was passing blood in the stool. And of course, this child was dewormed. There are lots of other different reasons. The older a child gets, the type of problems that we worry about in adults can be a real concern, and they must be taken really seriously. So what I'd like to talk to you about and help you understand is the type of problems, and a particular problem which, although it's quite rare, is something that I see in young babies as well as older children. This is a very rare condition, really, but it's related to food and allergies and mustn't be ignored. Vomiting, nausea, you know, difficulty gaining weight, poor growth, stomach ache, fatigue, constantly not wanting to go to school, not eating, picky eating. These are problems that you recognize. Please take note. And what I would say to you is, very importantly, I'm going to show you some of the things that we need to think about. The type of allergies that are really something to think about are eggs, milk. And of course, there are different types of milk. You know, there is soya, there is casein, almond milk, rice milk, coconut milk. All these things can be implicated. No matter what the diet, these things must be taken seriously. Of course, gluten and wheat is a very important thing to think about as well. So under-recognized. Is there a family history of these problems? Soya beans. Just because a child has a milk allergy, putting them onto soya, there's a 50% chance that your child could in fact also be allergic to soya. So don't necessarily think that going onto a soya diet is going to solve the problem. So what I'd like to do is to help you understand that, soya is not necessarily the savior. And also lactose intolerance is something completely different, remember. Peanut butter, peanuts, almonds, cashew nuts, all these type of things that can be related. Fish, these are the proteins that can be implicated. And with our mother's breastfeeding, these things need to be considered. Of course, whether it's a nice pizza, included in lots of different varieties. Now, of course, the symptoms that can happen, these can give rise to eczema, dry skin, children often having rashes, unexplained rashes, can be absolutely debilitating. It can affect suddenly coming up, scratching, unpleasant symptoms, and of course stomach ache, those cramps, gassy, unpleasant, debilitating, and of course the kind of vomiting, and of course it really can cause several problems. If these are the kind of problems that start, really you've got to have it sorted out. And of course, right from birth, the colicky symptoms that children suffer from. And we've often got to do lots of tests. You need to go to somebody who can understand these problems and put these things together. It's not a matter of just doing a blood test. Unfortunately, sometimes doing a blood test for allergies doesn't necessarily mean that your child has an allergy. Only too often I see doctors doing allergy tests, and because it shows a little bit of a response, doesn't mean to say your child's allergic. It needs somebody with a lot of insight to understand these problems. So, is your child just sensitive or are they allergic? Big difference between those kind of scenarios. So, what I would say to you is very important to understand how tummy aches need to be approached. When children need particular reasons, to find their parents, find their teacher, tell them about it, it can be serious in some cases. If a child is waking up at night, it really often means there's a serious problem. If it's school days, not at weekends and holidays, well, clearly that is associated. Migraines can cause tummy ache. Abdominal migraines is a cause. And children have something called inflammatory bowel disease that happens during those sort of later years, which can be very serious and need to be taken very seriously. And of course, acid problems, stress, anxiety, different medications the child's on can react. So what I'd like to ask you to do is to think about, is this problem been going on for a long time? Have you had lots of treatment? Have you had lots of kind of interventions? Are things not coming right? Are there lots of rashes? The condition called PIMS, Pediatric Inflammatory Multisystem Disease, which is this long COVID or complication. Children come in and they have tummy ache and they often look like they've got appendicitis. The youngest child I've seen with appendicitis is 18 months. So it can happen very early. As doctors, we've got to be really wide awake. So I thought I'd just share some of the reasons that children can have tummy ache. And the one is called Eosinophilic Esophagitis, where allergies, foods just trigger the immune system. It's like pouring fuel on a fire. It stokes things up. It causes lots of allergies, asthma, eczema, and of course the irritation in the tummy. And it doesn't respond to something called PPIs or the antacids or things that are often prescribed, something like Nexium, Losec, all those kind of problems. If a child doesn't respond well to medication and your child keeps getting tummy aches, that's something you need to do something about. So I thought I'd just share this as a common problem. As a specialist pediatrician, I often see children when they're not improving, and getting very frustrated. So before one tries lots of different laxatives, lots of stool softeners for prolonged periods of time, these are things that need to be taken seriously. There can be serious complications. So I thought I would help you understand some of these problems.